providing timely, relevant content to providers who care for children. Welcome to Pediatrics in Practice, presented by Children's Mercy Kansas City. Here's Dr. Michael Smith.
So our topic today is bacterial infection and fever in neonates and young infants. My guest is Dr. Russell McCulloh. Dr. McCulloh is the Associate Director of the Infectious Disease Fellowship Program at Children's Mercy Kansas City, and he's a professor of pediatrics at the University of Missouri Kansas City School of Medicine. Dr. McCulloh, welcome to the show.
Thanks for having me on.
So, infants with fever, right? How common is this? What's some of just the epidemiology around this presentation?
Well, fever in young infants is one of the most common reasons that they are brought to be seen in the emergency department or the outpatient setting. And a lot of that's because there's a concern for a serious bacterial infection, something like bacteria infection in the urine or the bloodstream or even the spinal fluid that can be indicated just by the presence of fever and no other initial signs or symptoms. It's important to note, though, that it is most commonly when you are working with an infant with fever that you're dealing with a viral infection or a simple uncomplicated infection. But it really takes having a discussion with a healthcare provider and a good, thoughtful exam to really help suss that out for parents.
Well, I think you kind of already bring up one of the challenges, right? Bacterial versus virus. What are some of those other challenges that, clinicians and healthcare providers, have to face when they're presented with, fever in an infant?
Well, the biggest issue is what is the appropriate evaluation based on an infant's age and how they've been doing according to the parents, and how they look on exam. And like I said, the most common thing that we encounter is viral infections, but there are certain bacteria that are commonly associated with infections in young infants. And in the office setting, which is the most common place where these infants are first brought, for infants in the first month of life in particular, the rule of thumb is often that you have to err on the side of doing a bit more testing than may ideally be desired by the parents to make sure that there's not an infection that, if left untreated, could result in some really serious illness.
So you mentioned, doing a little bit more testing. Let's talk a little bit about that. What exactly are the current guidelines for working up an infant with fever? And is there anything else that at Children's Mercy that you guys like to do?
Right, absolutely. Well, the first thing I'd say is that we've had guidelines available for pediatricians for basically the last 30 years for helping evaluate these young infants. And they have not changed a whole lot during that time, though our vaccines and the diagnostic tests that we're able to do have really moved forward. And so a lot of the work that we do here at Children's Mercy, and that I do in particular, is focused on trying to get some of this new testing and this new understanding of what causes these infections nowadays integrated into the care that these kids receive. But in terms of the testing that we talk about most commonly, you're testing three different sources on infants. One is urine, to see if there's a urinary tract infection. One is the blood, to see if there's bacteria in the blood. And the third is spinal fluid, to see if there's evidence of meningitis. And for infants under a month of age, that most commonly is those are the three routes of infection that are tested for and that are recommended to be tested for. In the second month of life, we can use some rules to help identify kids who can safely avoid getting particularly that spinal tap or that spinal fluid analysis at the beginning, and could maybe be observed first.
So let's talk. So once we know, so we're beginning that workup. In speaking to the community physician, the nurse practitioners out in the community, at what point do you recommend that if this is in an outpatient setting, that the child be brought into an emergency room?
I would say what I most commonly recommend outpatient providers when I get the call is, if you're in the first month of life, it is safe to report to do your initial testing there in your clinic urine testing, what have you. But for most of those kids, I would recommend that they get an evaluation at least in the urgent care, or perhaps the emergency department. If it's a true fever, which is measured rectally and is above 38 degrees Celsius, or basically 101.4 degrees Fahrenheit, so a significant fever. If it's sometimes it's a well-appearing infant who maybe was bundled tightly and may have seemed warm. If they unbundle and observe in the clinic and they're well-appearing and a repeat temperature is completely fine, then close observation and maybe follow up the next day is reasonable. But the hallmark of what I tell outpatient providers is that it's a combination of your clinical judgment with the parent's comfort and with really good follow-up in that first month of life. And in the second month of life, like I said, we have more leeway. And so a well-appearing infant there, we could do our initial testing, maybe all of it in the outpatient setting without having to go to an urgent care or an emergency department. And for those low-risk infants, just plan for very close follow-up and good instructions for observation for the parents if they're comfortable with it.
Yeah, and so Dr. McCulloh, just to kind of conclude our conversation here, what would you like people, specifically, the community physicians, the nurse practitioners, to really know and understand about fever in an infant? Okay.
I think there's three things that I think should be understood. One is that ensuring that we teach our parents the optimal way to take the temperature, which is still recommended either rectally without any temperature correction, or with excellent technique, sometimes under the armpit, can be acceptable. And that a fever in that first month of life is greater than 101.4 or 38 degrees Celsius. And that what I would recommend in the first and second months of life is, if they're calling in with a fever, bring them in, have them seen, lay eyes on them. The most important piece is that history and that clinician's exam, because outpatient providers know their kids better than anybody.
Right. That's very good advice, Dr. McCulloh. And I want to thank you for the work that you are doing at Children's Mercy. And thank you for coming on the show today. You're listening to Pediatrics in Practice with Children's Mercy Kansas City. For more information, you go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.